I'd say it's when they've been to X amount of providers and either they've been gotten the runaround or they told their case is impossible. That sort of gets me excited because I get the opportunity to potentially change this person's life, not just change it, but also take them from a place of despair where they think their case is absolutely hopeless and fix them up and give them form and function, make them look nice and make their teeth work.
Welcome to All On X-Perts, a podcast that shines a light on the specialized field of full arch implant dentistry for both dental professionals and patients. Each episode features discussions led by Dr. Olson with other leading experts, demystifying the All On X full mouth reconstruction procedure. By providing basic education, as well as exploring cutting-edge technology and techniques, All On X-Perts serves as a bridge between patients seeking reliable, comprehensive information about All On X smile reconstruction and dental professionals aiming to enhance their expertise. Get ready to explore the depths of full-mouth dental implant dentistry like never before.
What's up, guys? This is Dr. O, and I'm actually going to have to say I'm the counterfeit Dr. O because I'm interviewing for the first time here the real Dr. O. Would you please stand up, right? So this is Dr. O.H., Dr. Simon O. He is on our first episode of the All On Expert podcast. So thrilled to have him. What a jewel to have on the first one. So on this podcast, the idea is to connect with leaders in full mouth reconstruction with dental implants, get their opinions, their views on how treatment should go, answer some of the tough questions. So as a patient that's looking into finding who to trust, I hope this is a great resource for you. For doctors, you're going to learn a lot too, but this is really, we're trying to make an effort to help those that are looking for that person to trust, the office to go to. And I know that Dr. Simon O is an expert in full arch implant dentistry. He's got an incredible following on Instagram, lots of really interesting businesses and organizations. And so you guys are going to get a lot of great stuff today. So we will cover why Dr. Simon O loves implants, what makes him a reliable source in implant dentistry, where he started in his profession, his journey, his unique perspective on full arch implant dentistry, because I know he's got one. We'll cover his personal life towards the end and how he balances this absolute, I'm sure, I can tell it's an obsession with implant dentistry, and how he balances that with all the other things that life throws our way. So today, without further ado, I'll go ahead and introduce Dr. Simon O. Thanks so much. He only has a special, well, basically his special interest is in All On X treatment. Am I right?
Pretty much, yeah. I haven't really done much else in a few years now. So it's, yeah, I would say it's special interest / obsession.
Yeah. And it's fixing failing ones, right? I mean, that's kind of the niche you're in, right?
Yeah, it started off in virgin all-on-4 or virgin treatment, but, sort of what drew me towards it was the complexity of it. And now that I've sort of gotten enough cases under my belt where I feel really comfortable with the virgin cases, I think what the next logical step is to go and delve into the revisions, which is a whole nother layer of complexity. So I'm always looking for the next challenge, and I think that's sort of, the evolution of it.
Yeah. And so you seem to challenge yourself with a few organizations I'll list off here, right? You've got your co-founder of Smart Arches Dental Implant Centers, your co-founder of ORCA, Re-Edentulate Central America Association, and then founder of Smileback Foundation, and a prime educator with the All On X Master Class. I mean, there may be others. We'll obviously I'll try to get you all, to be able to comment about all of those things you're involved with. So when do you sleep? I've got to ask that out of the gate.
Usually from 8 to 4, my body just sort of wakes up at around 4 o'clock in the morning. And, that time period where no one else is awake is really great for me because I have young kids. So
yeah,
the household is always really noisy, but then I get like this sort of period of silence, and that's when I get to reflect and things like that.
Yeah.
In the morning.
No kidding. So you take advantage of the fact that you go to bed early, it sounds like 8 o'clock, and then 4, you get that. Okay. And how many kids do you have?
I have 2. They're 4 and 6 years old, so they're right in the chatty phase.
Yeah.
They're always they're independent enough, but still not independent to the point where like they don't really need me. So it's constantly dad this, dad that. So it's
I
it's
can
a
understand.
lot to handle.
Yeah, no kidding. So I have to ask this because right out of the gate, we kind of want to get figured out what made you and what drew you to dental implants. Why that choice of focus for you?
Yeah, from a just like a natural level, I think a lot of that came from my childhood. So like, you know, growing up, my parents didn't really have much. They were first generation immigrants, and money was a little tight. And so one of the things that instead of buying toys for me, that my dad used to give me old electronics, and I would just unscrew them, screw them back together, unscrew them, screw them. So I think the motion, I sort of have like, the childhood sort of reminiscence that we all dream back towards. I think I have really positive memories of just screwing things in and out. And so, lo and behold, decades later, I find that, the implants are a big thing in dentistry, which I, became passionate with. From there, it's just a natural inclination, I think. And then, on top of that, it's like, okay, I enjoy the work itself. It's very dexterous and, very sort of small components. And I really enjoy working with small things. But on top of that, the patient impact that implants provides for people is so far beyond like anything traditional dentistry has to offer, really. I mean, I'd say there's a couple of procedures in dentistry that really have the same impact, but from a standpoint of like, not just like the reveal of the patient, but also like what you're actually doing. Cause like, you got to think to yourself when when you pick like a certain aspect of dentistry you want to go into, whether it be like veneers or all on four implants or just general dentistry, you got to think to yourself like, okay, I'm taking a patient's health from here and I'm taking them from there to here. And so, with veneers, you're taking a very healthy patient and making them look great, which is awesome. Nothing wrong with that. But, where I wanted to sort of be was helping the people that needed it the most. And so the people with no teeth or teeth that should be extracted, I wanted to take them from a sort of desperate place and help them get back to a place of function and form. So that's sort of, I think, solidified my passion for this. And it's, it feels very natural to me.
Yeah, no kidding. It absolutely shows. I mean, I love following you on Instagram. If your patients or doctors probably, they're all following you. But patients, where would they find you? How do they find you on Instagram?
Yeah, my handle is SUBWRX04. It's actually an inside joke amongst my friends. It doesn't actually mean that I really love Subarus or anything like that. But it's like an inside joke because it was my my AOL screen name from back in school. But anyway, they can find me there. They can also find me on at Smart Arches on Instagram. We also have a YouTube account. We have a Facebook account as well. So those are a couple of places they can find
I'll
me.
make sure to get those from you and we'll put them in the link so people can connect with you there. That's awesome. So, where do you feel like you are absolutely at your best? So like what circumstances, what challenges with dental implants do you kind of feel like this is your sweet spot?
Yeah, I think it's my sweet spot is like and let's talk about a example patient. I'd say it's when, they've been to X amount of providers and either they've gotten the runaround or they told their case is impossible. That sort of gets me excited because like I get the opportunity to potentially change this person's life, not just change it, but also take them from a place of despair where they think their case is absolutely hopeless and fix them up and give them form and function, make them look nice and make their teeth work. That's really what teeth can provide for a person. So
Absolutely.
I think that's really where I shine. Some of the things that I really focused on early on in my career was like the rescue procedures, like things like zygomatic implants, pterygoid implants. I really wanted to be in a place where I could help those people that were really desperate because it's got to really stink to do that. And that's also, a main motivation for my work in Guatemala was, taking a population of people that were once in despair because they were told by so many providers that they trusted that just maybe weren't as informed as, they could have been to like what's possible. And then taking those people and really fixing them up and doing it in a rapid and convenient fashion.
Yeah, fantastic. So where did you start your professional career? Where'd you go to school? Tell me a little about your training, your experience.
Yeah, so I'm a Maryland guy through and through. I mean, I'm even wearing it now. It's it's all I wear. So yeah, I grew up in Gaithersburg, Maryland, which is right outside of DC. I went to the University of Maryland for college. I'm a terrapin and an angry turtle, basically. And then from there, I went to the University of Maryland for dental school. And then it was only during the match program that I ended up outside of Maryland. So I matched into Drexel Hahnemann Hospital for oral maxillofacial surgery.
Yeah.
I did that for a couple of years. It was a 6-year program, which means that I was attending medical school at the same time to get an MD. During that time period, I found that not only was it kind of not worth it in terms of the financial aspect, because I was paying for another doctorate on top of the one that I had just gotten. And then on top of that, I wasn't going to start working for another 4 years. And I had gotten all the experience that I felt comfortable with to do what I wanted to do, which is, dentoalveolar surgery in private practice. That's really what the main goal was. And I had gotten the experience to do that. We were covering 2 level 1 trauma centers. So, facial trauma nonstop. We were the only
Yeah.
service that covered these 2 hospitals. So I was fixing mandibles just about every single day. And from there, I felt very comfortable with the experience I had gotten. So I made the tough decision to exit the program and link up with my now partners. And the rest is really history.
Fantastic. So I can think of a few moments throughout my career where I've kind of had like a few moments where it was almost like the light bulb came on.
Yeah.
I'm just kind of curious from your perspective through your journey from obviously getting into implants, but maybe kind of along the line of full arch implant dentistry. What are some of the maybe light bulb or kind of enlightening moments that changed maybe some of the trajectory? Do you have some of those?
Yeah, I would say the 2 big inflection points in my career in terms of implant dentistry was immediate loading, or at least my discovery of that, and then remote anchorage implants or zygomatic implants, pterygoid implants. With immediate loading, really the light bulb went off because you go from this concept and, in dental schools, dental education, undergraduate dental education always teaches you the slow route. So you place the implant, you wait, you uncover it, you wait, you take an impression, you wait, and then you get your tooth. Whereas with immediate loading, you get the benefit or you get the upgrade right away. And so, you got to think of that immediate gratification. That's what healthcare is sort of gravitating towards. But the beauty of immediate loading is that it actually improves the success rate. And so you get the benefit of getting what you want right away. You get function right away. There's no downtime and the success rate's higher. Like, oh my gosh, like I got to get into this. And so when I heard about that, I read every book that I could get my hand on. I read every article I could. And lo and behold, yeah, the success rates are higher because what you're effectively doing is you're creating what's called cross arch stabilization or, full arch splinting. And so when you combine all those implants together, the success rate is actually a lot higher. It just takes a lot more orchestration or a lot more effort on our side, the clinician side. In order to pull that off, you need not only the surgical staff, but you also need a prosthetics doctor, whether it be you or somebody else. You need a lab technician to perform the conversion or at least help with it. Or you need the slew of technologies that can help you with that. And so with all that said, it's like, oh my gosh, like these people who are afraid of the dentist don't want to go through all these procedures now have a really great solution for them. Like there's a whole boatload of people who have dental phobias that have this great need of needing all their teeth replaced. And before it used to be, well, you got to be in a denture for 6 months. It's like, no one wants to hear that. You hear dentures, you hear gagging, you hear all this material,
Absolutely.
you hear no
Yeah.
taste and like flopping teeth and stuff like that. Whereas like, you get to avoid all that and the success rate's higher. It's like,
Right.
man, that's crazy. And so that was a big inflection point. That really got me excited. And then beyond that, it got to a point where I was doing so many of these cases, but in the same respect, there were some cases that I just couldn't help, or I was doing it in an old fashioned way where I was like doing sinus lifts
Right.
and delaying cases like that. Whereas zygomatic implants, again, you get to sort of skip steps, but in a way that improves success rate. And so with a double win like that, that gets me really excited. And so that I think really shaped my passion for, how I practice today.
Absolutely. Great answer. I love that. Those are definitely two critical things that really are driving full arch implant dentistry today. I think anybody that's doing this to a high level is looking how to obviously immediately load and then provide those remote anchorage solutions. So I love that. So you had to have some hurdles. What was maybe one of the largest hurdles you found along the way to get you to where you are right now that you had to overcome?
Yeah, in terms of hurdles, I mean, it's just a matter of sort of busting out of the mold. I'd say, the inception of what is now Smart Arches was a practice that wasn't doing so well that we had. So, backing up, I joined a group of about 8 offices early on in my career, and I was the exodontist. So I was the tooth puller and I was putting implants in, but again, in the old fashioned sense, placing the implant, waiting 6 months, and then loading the tooth onto it. I'd say one of the biggest hurdles and one of the biggest challenges, and also one of the most, I'd say, nerve-wracking moments, was when we decided to go all in for full mouth implants, because we had to not only change up the way that we presented ourselves to the public, we had to change up our workflow through and through. We had to change the labs that we were working with, the implant companies we were working with. That way we could gear it towards full mouth implants. And it was kind of a big risk because we had to sort of get rid of our old way of doing things. We had to retrain our staff, which is not the easiest thing. I'm
Right.
sure you know that. And then on top of that, there's a capital expenditure of new implant systems, having an inventory, which is a new concept, right? Because when
Mhm.
you're in single tooth dentistry, you can measure and then order that one implant and then put that one implant in predictably. But when you're doing full mouth implants, you need to have every size, shape, form of type of implant out there in order to serve the patient in the best way possible, because you never know until you get in there what exactly they're going to need. And so stocking all those implants in your office costs a lot of money. And so that was nerve wracking. And then on top of that, it's like, man, we've never actually advertised or done anything like that. So all this brand new territory, even though it sounds familiar, the 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 way that we felt about it was a complete 180 in our approach to things. So that
Yeah.
I'd say that was a big hurdle. But that's all in the rear view at this point. I'd say
Yeah.
that even though one of the most nerve wracking, it was the best decisions that we could have made.
Sure. Yeah. Now, I mean, the ability to see an opportunity, take, kind of cut away what's working, but chase something, focused, like
Right.
all on X treatment, full arch treatment, like you've done, is, at first, like you said, got some hurdles, got some challenges, maybe a little bit of dip that's a little uncertain, but looks like I'd say it's worked out pretty well for you.
Yeah.
So, what are some of the most like, we're talking to a patient, you're just like giving some advice to people. What are
Right.
some of the most important things you believe patients should know before they decide who to trust and where to go get their smile taken care of?
Oh man, that's a really great question, because, picking the right provider, I'd say is probably one of the most important things. When it comes down to it, think about the provider itself. So, what is out there? What's out there is you have a majority of general dentists. It's like a 5-to-1 ratio of GPs to specialists, and then you have specialists. So, okay, within the general dentists community, there are a lot of really talented doctors, a lot of. But, fact of the matter is that they may do this procedure 5% of the time in their daily life, right? Or they do implants, maybe a couple times a month.
Right.
And then you have the specialists, the same sort of situation. You have your oral surgeons that are used to doing wisdom teeth all day, or, they do jaw fractures in the hospital. They do maybe 1 or 2 full arches a month, maybe a year, something like that. And same with periodontists, across all the specialists. And so I'd say, picking the right provider, one that does this often, because like I was saying before, it's so orchestrated that, understanding where the clinician fits into the process, how well it's streamlined, understanding how the other provider works, getting the access holes as a surgeon in the right areas so that the prosthetic can be nice and snug and slim. All those things are so important. So I'd say, really researching and asking tough questions like, how often do you do this, doc?
Right.
Like, is it hundreds of times a month, or is it only a couple of times a month?
Right.
There was a really good paper that my wife was telling me about. She's in the medical community. There is a procedure, the pediatric renal transplant, I believe it was, is one of the most difficult things to perform.
Okay.
Predictability is rather low. But what they found was that the centers that do it the most often and are well orchestrated, they have higher success rates. So it's
Sure.
a function of how often they do it, the
Yeah.
success rate goes up. And so I have to assume that the same thing goes on with full arch implants because it's so orchestrated amongst several different providers. And to do it in a safe manner, in a predictable manner, in a way that gets the patient what they want and what they deserve, I think is paramount. And then on top of that, it's like, okay, what are the complication rates? Are important questions to ask. And then also what types of implant systems that they use, I think is also important. Just like, shoe brands, Adidas, Nike, Reebok, we have different implant brands that we use, and there's different tiers of
Sure.
those implants. And so I'd say, understanding what you're getting and who you're getting it by is very important.
That's great. No, my experience, I'm glad we're definitely in alignment on a lot of what we think here, but that is so true. When you're talking about focus and the amount of time spent doing this procedure versus other procedures,
Right.
that's critical because experience is, I mean, yes, you got to get training, you got to have, proper education on the matter, but at some point, really, I always feel like you learn so much by doing that if you're not consistently doing this procedure, and seeing the complications, the challenges, there's just no way to provide the best for the patient, right? And that's kind of what you're saying.
Absolutely. And on top of that, it's like, this procedure is not a cheap one.
Right,
Let's call it what it is. It's not a cheap one, but it's meant to be a lifetime procedure. And so
right,
when it comes down to it, the average American that gets this done, I think can only really afford to do it once, right? Like,
right.
can they really afford that amount of money the second time around? And not to mention the second time around is going to be more complicated. So it has the potential to actually be more expensive. So,
Sure thing.
picking that
So
right
as someone who's fixing failing All On X cases, what's like some of the common mistakes? What do you see the most challenge with?
Yeah, I'd say a big part of it is AP spread and also, or anterior posterior spread. So how far apart the implants are spread out. The way I explain it to patients is, tables have legs on the corners of the table, and it's because it's got to be balanced. If the legs of the table were focused to the middle of the table, the thing would fall over.
Right.
And so we don't want a diving board, we want a table. And so I'd say that's one of the biggest sort of mistakes that I see. In addition to that, it's also understanding the anatomy, just because, with our tilted implants, we tilt them in order to avoid certain vital structures, for example, nerves that give you sensation in your chin or the maxillary sinus, which are air pockets in your cheeks. I think being able to avoid that and having an in-depth understanding of anatomy is a very, very important thing.
Yeah. Yeah. So you're saying a lot of things you're coming in and seeing and fixing and addressing are maybe some improper angulation, not thoroughly planning the right spread so we don't have the right support.
Right.
Prosthetics fail, implants fail because of that, right?
Right. Yeah, I'd say that's a bulk of the
Yeah.
issue.
Okay, cool. What could doctors do to make certain that they don't see, God, they avoid these issues? So for the docs watching, like, hey, what's your advice to, hey, let's provide a higher standard of care as
Sure.
someone who's, yourself as someone who's addressing maybe some of the back end issues. How do docs avoid that beyond just the basics? Hey, larger AP spreads and
Right.
what are some things they can do?
It's easy to say these things, right? So just getting the right education, and that was the main motivation for two of my projects. One is called ORCA, Operation Redentulate Central America. It's a charity first, but it's funded through education. And so the people of Central America get to benefit from our efforts of United States standard of care. And in doing so, we bring doctors from either the United States or throughout the world. They come to train with us, and our faculty is some of the best in the country and in the world, I think. And you get to perform these operations on very deserving people who are getting it for free, but you're doing it under a 1-to-1 student to faculty ratio. Either myself or Dr. Juan Gonzalez or Dr. Dan Holtzclaw, some of the biggest names in our industry.
Right.
And we're going to hold your hand and walk you through this procedure so that A, you don't hurt anybody, and B, you can take these these really great concepts and principles back to the United States and back to your own practice. I think being able to perform that hands-on under the guise of somebody like that, I think is really important. And then in addition to that, we also have United States-based education. It's more didactic, more classroom-based, and it's called the Implant Masterclass. So we teach through the literature. It's science-based, it's evidence-based, so it's very much driven through data. And so, we have a lot of people coming through there to further their implant knowledge.
Fantastic. I love it. So what are some of the original approaches that you used to provide for All On X care that you've kind of trashed, and then how did you change them?
Yeah, I'd say largely the sinus lift. Whenever I think about a procedure I left behind, the sinus lift has been left behind, and
Yeah.
the reason is you know this very well. The sinus lift has not the best success rate, and what do we mean by success? It means turnover into actual living bone. Bone is not just a piece of mineral; it's a living tissue in our body that gets turned over from cellular turnover. And when it comes down to it, a lot of the times the sinus lift bone does not convert. And so you're not going to stick a screw into a piece of wood and hang a heavy picture on it when that wood is balsa wood, right? If it's very weak wood, you're not going to hang your TV on it. You need something solid. And so, the sinus grafted bone had the highest tendency to sort of not deliver on its promise. And not to mention procedurally, it's got a 25% perforation rate. So
Right.
complication rate's high, success rate is not very good. That was the one procedure I was looking forward to the most to leaving behind.
Right.
And boy, did we ever get to do that with things like pterygoid implants and zygomatic implants. Those two approaches, man, that really turned implant dentistry upside down. So
Nice.
I was thrilled when I got to learn that. I went and took a trip down to Brazil to see it with my own eyes, and got to practice it myself. And ever since, the amount of sinus grafts that I've done and performed plummeted.
Yeah. Awesome. Yeah. So for those patients that are watching, you may already know about, but zygomatic and pterygoid implants are basically remote anchorage. We're using areas outside of the alveolar ridge that maybe is atrophied over time from maybe missing teeth for a while. Like you said, maybe it's revision, maybe there's some failed implants.
Mhm.
And so being able to do something immediately with the bone that you already have in an area that works really well for long-term success. So anything you wish with the approach you have now, and I'm sure you've probably already fixed it, so this is kind of a silly question, but anything right now, the way that you do this procedure, are you like, man, I really wish there was a technology or a technique that would address this, and maybe what's the next frontier of progress for you?
Yeah, totally. I think what my wishes and desires, I think, really lie in the material science of things. So not necessarily the surgical technique. I think we're getting to a pretty good spot where we have many options for patients and many rounds of revisions. I think where we can develop the most is through material science. And so what I see a lot of people doing these days are doing rapid zirconia arches or zirconia in, say, a week or a day even. The downside with zirconia that fast is that it's so rigid that it transmits all the force up to the bone implant interface. And so I get worried about that interface. But on the flip side of things, I know why they do it. It's because the temporary materials that are out there today can be rather weak. And so with weak temporaries, you get broken temporaries, and that's not good for patients either. No one wants to have a broken temporary. And so finding that middle ground where it's strong enough to withstand chewing forces or mastication forces, but not so rigid that it transmits force to the bone implant interface. Finding that balance, I think, is going to be really important. And so I'm really excited to see things like graphene nano. There's newer nanoceramics. There's even 3D printed zirconia resins out there that are coming out. So I'm really excited to see where 3D printing in particular comes from, because we have two strategies. We have milling and then printing, whereas milling is deleterious or subtractive. You take a puck and then you grind it down, so it's a waste of material. Whereas 3D printing, it's maximally efficient. You're only printing what you want to keep. I mean, you're adding supports in there and stuff like that, but it's very cost effective. And so I'm really excited to see where we get to a place where we can have it be strong enough to withstand mastication forces, flexible enough to not transmit, but then also be aesthetic enough for patients to be really happy with the way that it looks. So
Right.
it's a balance of form and function that we battle with that I think no other medical specialist really deals with. Like most of the time, it's either got to work well or it's got to look good, whereas we have to do both, which
Right.
is can be very challenging for us. But again, I love the challenges. So it's just implant dentistry is a field that keeps on giving. You know what I mean?
Yeah. Yeah. You're that I'm glad you said that. I can totally relate with that being the area that I keep hoping is progressing. And it's obviously it is. And we've seen lots of changes in the past 5 years and few years. Hopefully it just keeps progressing that way. Now you mentioned something that I think we're both viewed the same way, and that's this maybe the you said week or next day permanent zirconia. What are
Yeah.
some of the disadvantages you see? We know the advantage obviously is solid locking implants together, but you
Right.
mentioned maybe there's some disadvantages to that. What are your concerns with it?
Yeah, I would say, and again, like think about what it is. Zirconia is ultra hard. It's if you bang them together, you hear a very high pitched clinging sound, and so what that means is that it reverberates forces a lot. And so if you get a patient that's a clencher or a grinder, and you haven't particularly measured how hard they're biting, you may actually be doing them a huge disservice because without shock absorbance, all that pressure is going up to the bone implant interface. And as we know, with immediate loading, although it works really well, the implants aren't actually fused or healed yet. They're not osseointegrated yet. And so it's got to be sort of babied to an extent. And so, one of the technologies that I've implemented in my practices is a technology called Enobite. It's by Cube Innovation. It's a
Awesome.
bite force measurement. And so what we do is we collect that data so that we can actually screen for these patients who are heavy clenchers or heavy grinders
Mhm.
without just saying you're a clencher or grinder. Like historically in dentistry, it's either you're A or B. It's a very binary system, black and white. But with this technology, we can actually quantify and get a number and say, hey, you fall here on the scale. We should
Yeah.
probably approach your case a little differently. Maybe we put you in a softer material for some time, or we give you Botox in your masters to weaken your chewing abilities, or we put you in a soft night guard for the temporary phase. I think with those strategies, we can certainly mitigate the risk, but yeah, when it comes to it, what gets me nervous when patients jump towards the rapid zirconia is that, this is a lifetime procedure. There's so much at stake, and, no pun intended, but there's so much at stake here that like it's the patient's livelihood. Why would we try to jump it a couple months and compromise the rest of their life? Because,
Right.
if you have a catastrophic failure of an all-on-4, there's a good chance you're going to need something more invasive like zygomatic implants in the future. And so if we have limited resources, limited attempts at this procedure to really improve someone's life, it would make me not feel right to put somebody in and to try to jump the gun and get them into permanent teeth so fast.
Yeah.
It makes me nervous. And especially when you consider their livelihood is at stake,
Yeah.
I just have to say no to that.
Yeah. A few things that come to my mind are maybe like, being able to love the new smile, be able to approve aesthetics. I like that you talked about the osseointegration. I never really I guess I just didn't really think a ton about the fact that, yeah, of course, that the high pitched aspect, the reverberation, it's going to not have any give compared to maybe something that has some give to it. Right. And then the gapping, I don't know how, maybe you don't get any gapping, but in my, I try to put in smiles the same day as well, that the spacing starts to occur a few
For
months
sure.
down the road.
For
And
sure.
obviously I don't want their permanent set to have those gaps. So,
Exactly.
yeah.
Yeah, and then, what's the solution? The solution is to reline it and add additional material, but the fact of the matter is you're gonna have a margin there, and margins can get dirty, and it might break down in the future, whereas, like, if you just wait a couple months,
Mhm.
you're gonna have teeth, just wait a little bit. We're gonna have the ability to chase that shrinkage and then really make a monolithic, one-piece, beautiful zirconia prosthesis that is snug up against the gum
Right.
tissue and stable. It'll stay like that for hopefully the rest of their life. And so
Yeah.
for me, it's like, why would you jump the gun on something so important? It just
Yeah.
makes me.
I agree with that. Yeah. All right. Now I'm actually I want to find somebody to interview and talk to them on the podcast. I want to hear the other side. I'm
Of
just
course.
curious. I want to know their thoughts and their experience, because obviously we all have different, but I tend to agree with your view on that. If somebody wants to come see you, and have you help them with their smile, I'm sure you see people from all over the country, but walk me through that process. Like, where do they go? How do they connect with you and your team?
Yeah, so we do virtual consultations online. So if they go to smartarchesdental.com, there's ways to get in touch with us. They can see the different locations that we have. And then, we are opening more offices. So we're trying to be as convenient as possible to as many Americans as we can. But we do virtual consultations. And so what that does is it cuts down on the initial appointment. That way you can save on flights and things like that. We have a lot of patients from out of state and, in fact, across the country, and in fact, out of the country. And so what we typically tell patients that want to come from out of state is, expect to spend a week here in the beginning, a week here towards the end, and then come back for your final delivery. And that's really it. When it comes to it, it's 4 or 5 working visits, and we can condense that down so that you can, just spend a week here at a time, a week here another time, and then come back for your final delivery. And that's really it. Yeah. So it's very convenient. And through the digital dentistry, that's really where the benefit comes in, is we can reduce the visits and keep it convenient.
How long are you going to make me wait to come see you?
I don't know.
How long you booked out, my friend?
I'm not sure, but we are busy frequently. So I would say, but we do try to get people in as fast as possible. I'd say we could probably get somebody done next month if we wanted.
Yeah. Good. I'm sure you're pretty efficient. You're able to squeeze people in. That's fantastic.
Mm-hmm. For sure.
All right. Anything? We're getting towards the end here. I love you've answered such a good job with all these questions. I've learned actually some of the phrasing and the way you communicate some of the challenges to patients. I love your approach. So anything you wish you knew 10 years ago as it relates to implant dentistry, that if we would have supercharged your career? I know you mentioned a few things, but is there any, what stands out as the advice you would give to Dr. Simon O 10 years ago?
Yeah, I mean, that's a great question. I mean, I would tell myself to read more, I think. The older I get, the more I find the value in reading what, our predecessors had left for us to read. That's really how we pass information down, is through our journals. So I think I would have read a lot more, because every time I pick up an article or read a book or pick up a book I've already read several times, I pick up something new. And had I started that a lot earlier, I think I'd be further along. But
yeah,
everyone's got their own journey.
Right.
Hindsight's 20/20.
Sure. Yep. Yeah. I always say I would have invested in Bitcoin.
Yeah, me too.
All right. So tell us about Smart Arches. I know that you've done. I mean, this is your co-founder of this. What makes you guys unique? Well, how are your offices different?
Sure. Yeah. So the way that, and, I'm a big core values kind of guy. The basis of Smart Arches was that we wanted to give Americans an alternative to what was out there. We wanted to offer basically better accuracy, better technology, better service, but at a discount. And when I say discount, I don't mean compromise. I just mean we take less profit. Right. And so what patients can expect is our fees are going to be roughly 30% less than I think what most people charge, but they're actually getting more value. And so when I say that, it's better technology to improve accuracy. Both you and I know the passivity of the prosthesis dictates the long-term outcome. And so all of our technologies that we've taken from, say, the automotive industry, photogrammetry, for example, came from aerospace, automotive. Like, I'm doing a PowerPoint right now. I was working on it before this podcast for a symposium lecture I'm giving, and it's on photogrammetry and how we took it from other industries to improve our outcomes. And so it's a triangulation system that helps pinpoint the exact positions and angles of these implants so that our restoration can sit on there without sort of being hinged up on one side and locked down on the other. This thing sits like a glove on top of the implants and gets screwed down. So we're using technologies like that. And what we found in implementing these technologies to improve outcomes is our margins are better. And so what we did at Smart Arches, instead of taking the additional profits, we passed it on to the patients and decided to lower our fees. And
Really?
so that way we can help as many people as possible. For me, you know, I tried to take Dr. P.I. Brandemark, who's the father of osseointegration. I tried to take the torch that he lit, which is, hey, it's 2023, 2024 now. No one should be dying with their teeth in a cup. And I want to take that. I took that to heart, and I would love to see a world without dentures. And so that's the motivation behind Smart Arches. And same motivation behind Orca or Mission in Guatemala. Same thing with the All On X Masterclass, is just to help improve outcomes, help as many doctors get good at this procedure so that they can help their own communities. You know, one thing I found as working in the DSO space, or the dental support organization space, with so many offices that I've overseen, is that small policy changes have large impacts across the board. And when I say that, I mean in a public health standpoint.
Right.
So if I can help teach Dr. X how to do this procedure well, he's going to do how many thousands of these procedures in his career. I had some influence in that. And so that makes me really happy. I think, I mean, as long as I do a good job teaching, right? So I think, you know, when it comes down to it, it's just, you know, there's a lot of negativity, a lot of darkness in the world. And, you know, with our abilities to change someone's life for the better, with giving them teeth that work and look great, you know, it makes me feel better that I can do as many as I can.
Yeah. Awesome. Well, I got just a few more moments with you here. I've, you know, like I said, I've kind of followed you for a while. I've seen, you know, you have a family. I'm sure you have hobbies, some other business interests, I'm sure. But tell me a little about your home life, a little bit, your family, maybe some of the hobbies that you might have.
Sure. You know, I'm my wife of now 8 years. She's a family medicine doctor, so we're a healthcare family. We met when she was in medical school and I was a resident, and we sort of just settled down and had kids together. And my wife, or my son Cameron, my firstborn, he's a 6-year-old, one of the most awesome kids ever. And then my daughter Claire is a total firecracker. And then we have 2 dogs, Max and Mandy. It's short for maxilla and mandible.
There you go. That makes sense.
Yeah. So huge nerd, but no, we have fun. In terms of hobbies, you know, before I had kids, I liked playing golf a lot. But that sort of went out the window. But no, I still enjoy that. But you know, I keep myself busy with my businesses and my different sort of projects. One of the other ones that I'm involved in is a company called Clear, which is a rum company. My partners and I bought a distillery out in Harrisburg, Pennsylvania, and we provide we call it a crystal rum. It's one of the cleanest, smoothest drinks you'll ever have. It's actually comes up cleaner than all of the major brands on gas chromatography. So it's not hangover proof, but you will have a much diminished one. That's for sure. So I'll get you.
So it's called Clear Rum, right?
Clear Rum, KLYR. Right now we're in Pennsylvania. You can buy it on e-commerce. I'll send you a bottle, but it's very good. It mixes very well, but you can also drink it straight.
Yeah, very cool. So I know that you're leaving something out. You're kind of you like to cook like I do a little bit. Tell me about that.
No, so cooking, I've always had a passion for cooking. My first job was in a restaurant, so I really enjoy systematizing things and learning recipes because, you know, you just repeat it, but you get again, instant gratification. You get a delicious meal afterwards. And so it's one of those things that, you know, it gets me out of my mind. So like, I don't have to, you know, I forget all of the day-to-day troubles or the struggles that I had during the day, the challenges. And I just get to focus on chopping the garlic. I get to focus on, you know, sauteing whatever it is. And then, you know, at the end of the day, it's like you get to make people happy. It's like when I have my friends over and I get to cook for them, everyone's got a smile on their face, and it brings people together, most importantly.
Yeah. That you're cooking in a little sip of Clear, they're in good shape, right?
Yeah, exactly, man.
All right. So, hey, the last few questions here. Thanks again for your time. I know this has gone a while, but I've learned a lot. I know the people that watch this, you know, we're doing another podcast, but the goals that I have, you know, hopefully they come through. We're not trying to go viral. We're trying to go deep, right? We want to create lasting relationships with other docs and experts. And we want to create content that really helps people make this decision that's so important, life-changing, like you said, and you'd want to do it right, do it once. So what is the advice that you would have for someone considering this treatment? what's the number one, like, nugget that you'd give them as a takeaway? I know you said experience, maybe that's it, but let them have it. What would you tell somebody that maybe isn't ever going to come see you? What would be your advice to them?
Just do your research. I know that a lot of times patients really trust their provider, but one story that really rings out to me was a lady that had reached out to me on Instagram because her trusted dentist of 30 years or so did some full arch work on her, upper and lower. She sent me the picture of her smile and it was atrocious. You could see the entire transition line where the gum meets the prosthesis. She looked like a freak, basically. She couldn't go out. She had lost, I think, 30 pounds because her bite was off. And she had reached out to myself and Dr. Gonzalez saying, like, please, I'm desperate. I don't have any extra funds, but I'm left like this. And, I can't live like this. So what we did for her, I do a charity case every quarter just because, again, the impact that we have on society is so big. I feel like it's my responsibility. So we did her case for free. We revised her for free, whereas the other doctor got paid well, which is fine. Look, money's not the most important thing. But what that tells me is that, just because you trust your provider, and I'm not saying don't trust your provider, but because if you trust your provider, just do a little extra research, go talk to more people, get different perspectives on what you should have done. Because when you talk to 10 different dentists, you're probably going to get 10 different treatment plans in some aspect. And so, I just, again, you really only have one good shot at this procedure, good shot at it. You can be revised successfully, but it's not as clean and clear cut. When you do it the first time, that is your best opportunity for success, just like any procedure in dentistry. And so my biggest encouragement is get 4 or 5 or 6 different opinions, see who makes the most sense, see who's doing it the most often, see who has a good reputation, see who, has good outcomes, and then, make your decision from there. Ultimately, if it comes down to, your actual dentist of 30 years is the best option, go with it, but please don't leave stones unturned. It's just such a travesty to only go to one place and get it done by them and then have it be screwed up. That's my best advice.
I think that you were basically saying get second, third, fourth, fifth opinions. You're not going to get, I think you nailed it. I would try to tell patients that too. Like, hey, it's never going to be a disservice. You're not going to offend me by getting multiple options and choices on the table. I think that's just going to help you make hopefully a better decision. And obviously we hope that that's our practice and your practice, right? So, man, thanks so much for your time, Dr. O, the original, the OG Dr. O. I'm just the counterfeit, right? Just adding that on there. I think I had kids teasing me about calling me Dr. O, and I'm like, I was going to start a YouTube channel, and we're going to go with Dr. O. So I did. And then I saw you later on. I think I'm like, oh, I just kind of, totally copied the guy.
No, so good.
Hey, if you're a patient watching right now, I encourage you. Dr. O is a phenomenal resource. Go to his Instagram page. He's on TikTok as well, all the social. Obviously a great clinician, cares about his patients, clearly is an expert in all on X treatment. If you're a doctor, definitely go follow him. If you're not already, what are you doing? He's an expert in this, and you're going to learn lots from his posts. I know I have. So I'm very grateful for that. As someone who's never paid you a dime yet, I'm very grateful for what you share and your expertise in the community. So definitely don't forget to subscribe to this podcast. Or basically the YouTube channel, but or the podcast. We're going to be posting these on both places for now, but definitely going to be coming up with some great guests. We've got Dr. Sonata going to be on next time, I believe. And then we got Dr. Mike Picos. So excellent educators, very skilled clinicians. So we're really excited to have that crew. So definitely check out the live implant webinar we host every week to help educate patients, and keep smiling, guys. It looks good on you.
Thank you for listening to All On X-Perts, the podcast dedicated to advancing knowledge in full arch implant dentistry. All On X-Perts is committed to enriching dialogue around dental health and innovation. Make sure to follow the podcast on your favorite platform to never miss an episode. Join us again as we continue to bridge the worlds of dental professionals and patients, enhancing understanding and expertise in implant dentistry. See you next time.